Hey guys, it's Dr. Giles here with Aspire Chiropractic. Do you have low back pain and somebody, maybe your friend or a colleague or a trainer, told you that if you strengthen your abdominal muscles that it'll help with your low back pain? Well, that's 100% true. But the fact is, most people don't understand their abdominal muscles, so they're most likely doing the exercises all wrong and maybe even hurting their back more. So let's talk about it. This is your spine. Actually, it's a little bit of a noodle, but it's going to represent your spine. And these pieces of tape represent your abdominal muscles, the rectus abdominis. That's that six-pack, the most superficial layer on the top of the stomach that everybody is trying real hard in the gym to develop. But your abdominal muscles are actually 4 layers deep, and they act as stabilizers for your low back. So if you're in the gym and you're hitting it hard on the crunches and the sit-ups and your low back pain is not getting any better, well, let's see how good these rectus abdominis muscles are at stabilizing. I'm going to put it here against the wall, and let's see if it stabilizes the spine against the wall. Not very good, right? So let's do this. Let's take these rectus abdominis away. And let's actually demonstrate what our abdominal muscles look like and how they operate. First and foremost would be our deepest layer of abdominal muscles called the transverse abdominis. It runs across your lower stomach, and it acts like a natural weight belt for stabilizing your lumbar spine and all the organs that are in that area in your thorax. Next, we have our obliques. We have our internal and external obliques, and they run from superior to inferior, crisscrossing that transverse abdominis, adding extra layers to the abdominal muscles, making that spine more and more stable. Look at that. You can see that right there. We've only added our transverse abdominis and our obliques, and already this spine is way more stable than if we had just put the rectus abdominis muscles on there. Well, let's add those back. There we are. And one more. Oh my goodness. Look at all those muscles. Look at how stable that spine is. So if you're in the gym and you're just doing the crunches and the sit-ups and the leg lifts and you're only focusing on this six-pack muscles, you're not actually doing anything to help your back. It's these deep core muscles that are the ones that are going to do all the benefit for stabilizing your spine. They're going to protect it, they're going to actually act like a natural decompressor for it, and they're going to help improve all of your breathing once you start activating them. Now let's talk about activating them. You can definitely do that by looking up videos and exercises and getting in the gym. But the most important thing you could probably be doing is seeing your chiropractor. Why? All these muscles, just like every other muscle in your body, is innervated by the nerves that are coming out of right here, your spine. And if we have issues in the spine, kinks, twists, something we call subluxations, well, that's affecting the nerve flow to those muscles. And you can be in the gym all day doing all those abdominal exercises all you want, but you're not getting the full activation that you need to be able to take the pressure off of your spine, activate those muscles, and actually start to give yourself some relief from your low back pain. So if you've been hitting the gym, hitting your core muscles, and you're still having tons and tons of back pain and you're not getting any better, come on into our office here at Aspire Chiropractic. Let's get you adjusted. Let's talk about what's going on. Let's get you on the right path, because we're ready to help you when you're ready to be your best, naturally.